Thank you, Paul, and to the Board of Directors and Network Affiliates of Mental Health America for the opportunity to join you, and even more for the work that you all are doing every day to protect and improve the mental health of all Americans. These are truly unprecedented times. The COVID-19 pandemic has hit us hard, especially people of color and those who are older. And as you well know, the reasons are many and are rooted in both social and medical conditions that conspire to reduce resilience, opportunity, and health, including mental health. When we think of the pandemic, most of us immediately think of healthcare. And as critical as healthcare is, we know that health actually begins at home, in communities designed to provide income and financial security, education, access to transportation, safe places to be active and healthy, affordable food and housing, and all of these things must be provided free of structural and institutional barriers related to race and bias. What we've observed in COVID-19 are the significant gaps in both equality and equity in communities when it comes to these social determinants of health. These social determinants contribute to medical determinants, chronic diseases such as diabetes, lung disease, and high blood pressure. It should be no surprise that these diseases are especially common in people of color. Social determinants make individuals more susceptible to infection with COVID-19, while the medical determinants are associated with more severe COVID-19 complications and more deaths. For example, we know that social distancing and teleworking are critical to preventing the spread of coronavirus. Yet only 1 in 5 African Americans and 1 in 6 Hispanic Americans have a job that allows them to work from home. People of color are more likely to live in densely packed urban areas and in multi-generational homes. They are also more likely to use public transportation. And these factors create a greater risk for spread of a highly contagious disease like COVID-19 and make it harder for people to isolate or quarantine if they have been exposed to or diagnosed with the virus. So it's no surprise that we've seen American Indians and Alaska Natives and African Americans hospitalized at rates 5 times higher than whites. Hospitalization rates are 4.5 times higher for Hispanics compared to whites. This virus is exploiting and exacerbating pre-existing health disparities, and these disparate outcomes and unequal opportunities to be healthy are part of the anger and frustration and the fear manifested in protests around the country. Put simply, health equity is social justice. That's why I've made it my mission as Surgeon General, long before COVID-19, to emphasize the importance of both mental and physical health for all. In the midst of this pandemic, it is clear that each merits attention and action. Unfortunately, we are only beginning to learn about the true impact of this pandemic on the mental well-being of Americans. As of June, more than 88,000 Americans have developed symptoms of anxiety or depression related to the stressors induced by COVID-19. With that in mind, the time is now to invest in prevention and early identification to get people the help they need and deserve. We must address the fragmentation of systems and apply what we already know works to save lives. The ripples of this pandemic have altered healthcare delivery and access to mental health services. And because of that, I'm deeply concerned about the consequences on the well-being of our citizens, no matter the color of their skin. We know that stress can also worsen substance misuse. Turning to substances such as marijuana and alcohol is a way people try to cope. These stressors pose additional risks to mental health, but we know that our emotional well-being and resiliency can act as protective barriers against them. By focusing daily on caring for our own emotional well-being and supporting the well-being of those we love, I know we can successfully mitigate the mental health effects of COVID-19. That's why I remain steadfast in encouraging Americans to use healthy mechanisms to cope and to band together to practice the tried and true habits that will keep us safe and healthy in mind, body, and spirit. Now is the time to reach out to friends and family, especially those who may live alone. Whether it's through a phone call, a video chat, or a socially distant and responsible get-together, remind them that you were there for them. And please, know that it's okay to ask for help. SAMHSA's national helpline has trained counselors standing by to take your call at 1-800-662-HELP. The helpline is free, confidential, and available every day of the year, no matter the time. I want to applaud Mental Health America for the incredible work you've done during the pandemic. You're leading the way in prevention and in early identification of mental illness. For example, the Mental Health America online screening program is an outstanding example of how we can leverage technology for improving preventive health. The before stage 4 philosophy represents how we as activists, healthcare professionals, and policymakers must address mental health using a prevention framework. I want to close by coming back to the COVID-19 pandemic. While it's been a challenge and we're still discovering what this novel virus is and does, it's important to note that we've learned so much about this virus in the last 6 to 7 months. We know who is most at risk and why, as well as how to protect them. When it comes to mental health, we know that social isolation, while great for reducing the spread of COVID-19, can be devastating for many individuals who lose touch with loved ones and the routines and interactions that help support their mental well-being. It's critical that we support one another. We know much more about how to treat those most severely affected. We know that we must address the underlying drivers of disparate outcomes, those social conditions that can either limit or unleash a healthy future. We know what works to keep people and their communities safe and have launched an aggressive messaging campaign called #COVIDStopsWithMe. I ask that you visit my Twitter account @surgeon_general to watch the video and share it within your organizations, networks, and with your loved ones, because I need your help in spreading the word that our health, our nation's future, is literally in our hands. And I want to leave you with my mantra, the 3 W's. Number 1, watch your distance, meaning stay at least 6 feet from others and avoid crowded indoor spaces. Number 2, wash your hands, what your mother always told you. And number 3, wear a mask. Practicing the 3 W's will help us reopen, rebuild, and restore our mental and physical health, our relationships, and our communities. Again, thank you for having me today. I believe we have the opportunity now to reinvent a nation that is more resilient, more equitable, and healthier in body, mind, and spirit. This will require our best work, and I look forward to realizing this future with you together.